Here I am going to discuss about the topic is measles. Measles is a highly contagious, vaccine preventable infectious disease caused by measles virus. Then the symptoms usually develop 10 to 12 days after exposure to an infected person and last 7 to 10 days. The initial symptoms typically include fever of a greater than 40 degrees Celsius. In Fahrenheit is 104. Then cough, running nose, and inflamed eyes. Then small white spots known as scopic spots may form inside the mouth 2 or 3 days after the start of symptoms. Then the red flat rash usually start on the face and then spread to the rest of the body. Typically begins 3 to 5 days after the starts of symptoms. The common complications include diarrhea, middle ear infections, pneumonia. These are the complications. These occurs mainly in immunocompromised persons. Less commonly in seizures, blindness, or inflammation of brains may also occur. The common is a highly contagious childhood disease. It is characterized by mainly fever, respiratory symptoms, is followed by typical maculopapular rashes. Then comes in the pathogenesis. The pathogenesis, the first is transmission. Measles is an airborne disease which spread easily from one person to the next throughout the cough or sneeze of infected people. It may also be spread through direct contact with mouth or nasal secretion. It is extremely contagious. 9 out of 10 people who are not immune and share living space with an infected person will be infected. Then the transmission occurs predominantly via the respiratory route, is either by droplet inhalation over short distance is the most common. Then the small particles, aerosols that remain suspended, especially in schools, hospitals, and enclosed public places in the air for longer period, is very less common. Then spread. The virus multiply locally in the respiratory tract, then spread to the regional lymph node, then enters into bloodstream in infected monocytes. Is a primary. This condition is known as primary viremia. Then further multiplies in reticuloendothelial system, then spills over to blood. Is a secondary viremia. Then is disseminated to various sites. This is the main pathogenesis of measles virus. Then the target site is the virus is predominantly seen in the epithelial surface of the body, including the skin, respiratory tract, and conjunctiva. This is the main target of the virus seeded. Then comes into clinical manifestation. The incubation period is about 10 days, which may be shorter in infants and longer, up to 3 weeks in adults. Disease can be divided into 3 stages: prodromal stage, eruptive stage, and post-measles stage. First is prodromal stage. This stage lasts for 4 days. That means from 10 to 14 day of infection, and it is characterized by manifestations such as fever and Koplik spot. Fever is the first manifestation, occurs on day 1. That means 10th day of infection. Then develop Koplik spot. Koplik spot appears after 2 days of following fever. That means on 12th day of infection, and it is characterized by white to bluish spot, almost 1 mm in size, surrounded by an erythema. Then appears first on buccal mucosa near second lower molars. Then it is rapidly spread to involve the entire buccal mucosa and then fade with the onset of rashes. Then some non-specific symptoms may be present such as cough, coryza, nasal discharge, redness of eyes, diarrhea or vomiting. Then second stage is eruptive stage. In maculopapular, dusky red rashes appears after 4 days of fever. That means on 14th day of infection. Rashes typically appears first behind the ears, then spread to face, arm, trunk and legs, then fade in the same order after 4 days of onset. Then the rashes are typically absent in HIV infected person. Then the third stage is post-measles stage. It is characterized by weight loss and weakness. There may be failure to recover and gradual deterioration into chronic illness. Is the Koplik spot? Is the body rashes, maculopapular rashes. Then complications. The main complication of measles is secondary bacterial infections. Following measles, there is a profound immune suppression and a fall of cell-mediated immunity, which in turn predispose to various secondary bacterial infections such as otitis media, bronchopneumonia is the most common. And then recurrence of fever or failure of fevers to subside with the rashes. These are the main complication. Then the central nervous system complications are rare but most severe. Post-measles encephalomyelitis is developed within 2 weeks of onset of rashes. It represents an autoimmune response against the myelin basic protein. Its occurrence is about 1 in 1000 cases, affecting mainly older children and adult. Then measles inclusion body encephalitis occurs month of rashes, typically affecting people with defective cell mediated immunity. Then subacute sclerospan encephalitis. It is a slowly progressive disease. It is characterized by seizures and progressive deteriorations of cognitive and motor function. Subacute sclerospan encephalitis is to group C. Slow virus infection is caused by a defective measles virus. It's mainly occurring less than 2 years of age. Then laboratory diagnosis. First is specimen collection, nasopharyngeal swab, conjunctival swab, blood, respiratory secretions, and urines are the ideal specimen. Synthetic swabs are recommended. Then it is antigenic detection method. Measles antigens in the infected cells can be detected directly by using anti-nucleoprotein antibodies. It is a direct immunofluorescence method. Then it is a virus isolation method. Is a cell lines method are available. Cell lines methods are follows: monkey or human kidney cells or lymphoblast cell lines are optimal use. Lines used for the isolation of measles virus. Then some demonstration of multinucleated giant cells, Franklin cells in Gimsha smears of nasal secretion, Koplik spots biopsy. These tests are used. Then direct immunofluorescence antibody test, antibody detection of measles specific IgM antibody in serum or oral fluid, or fourfold rise of IgG antibody titer between the acute and the convalescent phase sera is taken as significant. Demonstration of raised and titer raise of anti-measles antibody in the CSF is diagnosis of subacute scleropan encephalitis. ELISA is the most recommended test that uses recombinant measles nucleoprotein antigen. IgM antibodies are detected by capture ELISA, whereas IgG antibodies are detected by indirect ELISA. In the past, other tests such as neutralization test, heme agglutination test, then complement fixation test were used. Neutralization tests are sensitive and specific and result highly correlated with protective immunity. However, require maintenance of virus in cell lines and is the expensive and labor intensive. Then a reverse transcriptase PCR, RT-PCR is available target measles specific RNA such as N genes is a nucleoprotein in clinical specimen. The RT-PCR is a extremely sensitive and specific test. It may also permit characterization of measles virus genotype for molecular epidemiological studies. It can distinguish wild type from vaccines virus strains. As the RNA can be detected in a specimen up to 10 to 14 days post rashes, in contrast to virus isolation, which often to become negative after 3 days of rashes. Then prevention or prophylaxis. The general preventive measures, airborne precautions such as isolation of negative pressures room, use of PPE such as N95 mask, etc., must be followed while handling measles cases. The passive protection means first is measles vaccine. Live attenuated vaccine is available for the measles. The strains is the most attenuated strains that is currently used. The vaccine is prepared from chick embryo cell lines. The vaccine is available in lyophilized form and it has been reconstituted with distilled water and then should be used within 4 hours. The vaccine is thermolabile, hence it is must be stored in minus 20 degrees Celsius. One dose, that means 0.5 ml containing more than 1000 infective viral unit is administered subcutaneously. Some the combined vaccines are available. Measles vaccine is available in combined form with rubella. Then says MR vaccine with mumps and rubella vaccine, MMR vaccine, and with varicella. That means MMR B vaccines are available. Then gamma globulin given within 6 days of exposure, usually in immunocompromised, immunodeficiency, pregnant women, and special risk of then live attenuated vaccine is given by itself or in combinations as MMR vaccine. Single subcutaneous infection is the recommended age is 9 months. The side effects include mild measles-like illness may develop in 15 to 20% of vaccine. There is no spread of the vaccine virus in the community. Some is toxic shock syndrome due to contamination of viral with Staphylococcus aureus toxin. These are the side effects of the measles. Then indication under National Immunization Schedule of India, measles rubella MR vaccine is given at 9 completed month to 12 month along with vitamin A supplements and second dose of MR vaccine at 16 to 24 month. The second then the measles immunoglobulin, that is IG, can be also given within 3 days at World Health Organization recommended dose is 0.25 mg per kg of body weight. However, both vaccines and IG should not be given together. At least 8 to 12 weeks of gap must be maintained. Okay, thank you.